Halo, selamat malam, selamat bergabung kembali di awal tahun 2021 ini di IG Live, bincang bareng Maestra malam ini. Di mengawali tahun ini, IG Live kita akan sangat spesial karena akan berbincang dengan Mark Boothroyd, yaitu perawat di NHS Inggris, ya, National Health System Inggris, suatu asosiasi perawat di Inggris, yang akan menceritakan pada kita bagaimana situasi COVID-19 atau virus corona di Inggris saat ini yang semakin meningkat. Ya, kita sedang menunggu live dengan Mark, akan sudah bergabung malam ini. Dan buat kalian yang ingin langsung bertanya, bisa di kolom komentar, ya, malam ini. Hello Mark, how are you?
Hey Maestra, I'm alright, thank you. How are you doing?
I'm alright too, thank you.
Yes.
So nice to meet you again, Mark.
Yes,
so
it's good to see you again for so long.
For a long time, and I very appreciate you can take the time for tonight, the very interesting discussion in my IG Live about COVID-19 in UK.
Yeah, I'm very happy to join you and talk about my experiences and a bit of what is happening in the UK with the COVID-19 pandemic. Yeah.
Yes. Yeah. So we can talk more today and about how about the situation now in there, and then maybe we can share together. Okay, Mark. We can start. So in the world, also in Indonesia too, these cases COVID-19 is more growing up. In Indonesia, yesterday we have the record 14,000 people positive. And then and every day is always higher. So and I'm listening in the news, in the big news in UK also have the problem same. I saw yesterday is around 100,000 a day positive cases, right?
It's actually begun to fall. The number of cases has begun to fall because of the lockdown.
Okay.
But we are still much higher than Indonesia. So I think a couple of weeks ago we were getting about 70,000 a day infections. 70,000. And it's now fallen to, the last day, 1 or 2 days ago I checked, was 49,000.
49,000 today.
Yeah. Yes. Yeah.
Okay. So is it?
Sorry, go on.
Yeah, you're right.
I was saying we've been put in a lockdown now, and because people are not going to work and not socializing, the number of infections is falling, but it's still much, much higher than in Indonesia. But it sounds like you are where we were maybe 6 to 8 weeks ago, because we had that level of infections and it has just gone up and up and up and increased greatly.
Increased and then have the new mutation, right?
Yes. So there's been a mutation of the COVID virus, and it has this was first detected in September, but the government, they claim they didn't know how significant this was, and then in November, looking at analyzing how rapidly it was spreading, they estimate that it's maybe 50% more transmissible or infectious than the original COVID one, and that has added to the spread of the virus. Yeah.
So the fastest spread, super spread virus,
Yeah.
Okay. So now I wanted to know, how about the current situation in London with the patient of COVID?
So I think the last figures I checked, I think we have about in our hospitals that we have about 4 to 5,000 patients with COVID in London alone in hospital.
4,000.
For about 4,000, I think.
4,000. Okay.
Yeah. So, so London is the capital. We have a lot of hospitals, but still 4,000 beds taken up just with COVID-19 is a huge amount just in London alone. And then there are tens of thousands more people at home who are managing the illness at home. So the situation is very bad. And London was hit quite badly in the first wave, but it is now much more prevalent than it was then. I mean, from my own experience, so I unfortunately I caught COVID in December, and I put this on my Facebook to say, oh, I have caught COVID, and lots of my friends, said the same. People I knew, a lot of people have caught it, so it's much more widespread than it was, and we've gone past the peak where we were in the first wave in April. So we have more COVID patients in hospital now than we did in April. And we thought April was a very bad situation. So now it's much worse.
Much worse. So how many patients a day? Mostly.
So in my hospital, I'd say we're probably getting about 100 a day into our emergency department, and maybe 20 to 30 of those are needing admission into hospital. But this is why why it's becoming unmanageable for the health service, because that level of admissions, we need to find 20 or 30 hospital beds a day for these new patients, and when they get admitted to
hospital a day?
No, sorry, hospital beds.
Oh, hospital. Okay.
Yeah, so we're getting 20 to 30 admissions a day in my hospital, but it's similar across London. So and that's an enormous amount of hospital beds to find on top of the usual number of sick people we have. So in winter, our hospitals are normally very full and very busy anyway, but now we are having to cope with COVID on top of that. And the last figure for my hospital alone, we had 400 patients with COVID. And there are about 20 hospitals in London, and most of them have a similar. They are very full of COVID patients. So
is closely to overcapacity?
Yes, yeah. I mean, many of the smaller hospitals, which, like, I work for a large teaching hospital which has 900 hospital beds, which has 900 beds. So we're a very big hospital. But there are many smaller hospitals, maybe 100, 200 beds, and they are already full. They have no extra capacity. So we are having to they are transferring patients to us to create space so they can admit. So it's a very disastrous situation. We are having to take patients all the time from smaller hospitals, which we don't normally have to do even in winter when it's very busy. Most hospitals can manage, but the number of infected patients is overwhelming our health service. Like, we are not doing anything else except treating COVID patients. We have no surgery is happening, no elective surgery. So people who need an operation on their heart or need cancer surgery, all of that has had to be cancelled because we cannot.
Yeah.
We don't have enough staff to do this, and this is across the whole NHS.
So the whole hospital is just for patient of COVID.
Yeah, basically.
So how about let's say like cancer or maybe stroke, heart disease? Where there will be?
I mean, we will still, if there is an emergency, we will still, obviously, we have capacity to do emergency operations, but the planned surgery or elective surgery there is no capacity for it. So there's those, and it's a struggle to find. It's a struggle to cope with those emergencies on top of all the COVID patients. So It's a
So
very bad.
if they like telemedicine, maybe he can or they can contact the doctor from the application or
Yeah, so a lot of our, as much as possible, we have tried to move those like consultations to you could say telemedicine over the phone or over video calls like this. So our consultants are and general practice, your local doctor in the community, they are doing a lot more over the phone and video conferencing, but that it's not as good. You cannot do a good assessment over the video call or thing. You need to see the patient, you need to physically assess them. So the standard is the level of care we're giving is lower, and it's and some patients, they can if they have to wait 4 or 6 weeks for their operation, some patients will be fine, but some they need an operation within 2 to 4 weeks, and we are not at the moment really able to give that. And and we know that there are patients who are unfortunately dying in the community because we cannot perform the surgeries they need at the moment.
So example, like in here, have the like a center of the COVID patient is the athlete Wisma athlete, the like a village, athlete village. It can be around 5,000 patients in there. So if the people have the positive of COVID, they will be go to the athlete village. For the some asymptom, without symptom. So patient without symptom in there, but patient with the symptom will be in the hospital. Like middle symptom. Now, how about in UK? Have the like center for the patient without symptom or?
So the policy in the UK is if you don't have symptoms, you should isolate at home. And we had at the start of the pandemic, you had to isolate for 14 days. They have reduced it now to 10 days. So, but yeah, you isolate at home. So you're sent home and you stay there. In effect, this is potentially the government could have made an alternative, like you say, set up an isolation village, but they instead they just said isolate at home. And what this means is if you get an infectious person, they have to stay home, and a lot of times they will infect everyone they live with then, because not many people have a big enough home where you can distance from yourself from your you share the toilet, you share the kitchen. It's very hard to stop, so that is, but the policy is you isolate at home for 10 days if you have a positive test and you have no symptoms.
Who is the control in the home? Have community or in here have the community, and each community have the leader. To the control, but how in there? Who will control?
Well, this is one of the problems. Is there is not no one is controlling this. It is just relying on people to follow the rules. So, and we have had various studies to see how much people are following the rules, and there is generally most people, maybe 80%, follow the rules. So you have your swab, your test, and then you get a text on your phone to say you have COVID and you should isolate for 10 days. And then you have to follow, they will generally assume you're following the rules. You'll get a phone call from the testing system. They will say, oh, you have COVID, are you staying at home? And you obviously, and they will take your details, and we have they would carry out a what we call the contact tracing process, where they will ask you, who have you had contact with, who have you seen, where have you been, and they will try and contact those people who you might have exposed to COVID and ask them to get a test. But this system has been it's a privatized system. they did not give it to the local public health organizations to run. Instead, they gave it to private corporations like a company called Serco, and they have run it, and they have run it very badly. Um, and it has not worked very well. Like, yeah.
Yeah, continue.
So the figures show maybe the contact tracers were only able to contact maybe 60% of people. Maybe 40% are, they're not answering the phone, or they're not telling people who they have had contact with. So it's not very successful, and this is part of the reason we think that the virus has spread so much, because the systems which are meant to control and trace the virus are not working well, partly because they're being run for profit rather than for the public good.
Yeah. How about the public, the government to tackle this? And who is the responsibility if some in the isolated more symptom? Who the responsibility if the ambulance directly come, or they are called, or like what?
Oh, I mean, yeah. So if people are sick in the community, they just have to call an ambulance, and they will come and collect them. But again, because there are so many infected people now, the ambulance service is very busy, and they cannot get to everyone very quickly. I mean, in London, you know, every day now the ambulance service is getting as many calls as they do on the busiest day of the year. So they, you know, maybe normally they get 4,000, 5,000 phone calls a day. Now they're getting about 7,000. So they have a huge number of visits to make, and it's putting a lot of strain on the health workers, on the ambulance staff, and on the people taking the phone calls. They are very busy. They're being overwhelmed by the number of cases and the number of people who need to be seen.
Oh, so the responsibility is by self, not left organized by you here in the NI system or the government system is how to manage if the the cases is not little in UK now, in London itself is 14,000, you said,
Yeah.
So how they manage so this COVID is not more spread to the community, or
well, just to make sure, you want to know what they're doing in the community to manage the spread. Yeah. Well, we went into a lockdown on January 5th. So schools are closed, many businesses are closed. Everyone who can is being urged to work from home or just to stay home. So this is the main policy we have at the moment to control the virus, and it's having some effect. You know, I said at the beginning the number of infections has fallen from about 70,000 to 49,000. So it is working, but the problem is so that's the main policy, and that is a national lockdown. So everyone in the entire UK has to stay home, and if you have a job, then the government is paying your salary just to stay home at the moment. So, and if you are not working, you have a small amount of unemployment benefit. So you get about £90 a week to stay home.
90.
90.
Oh, 90 a week.
Yeah.
Paid salary.
Yeah. If you're unemployed, if you are
jobless.
If you're employed, if you have a job, you will get 80% of your full salary to stay home. So there is support for people, but it's not the main problem is that a lot of this relies on the business to tell the worker to stay home. The business owner must say, okay, I want you to stay home, and they must apply to the government for this money. And some businesses, they're not doing that. They're telling their workers to come in still and come to work. And the government is not changing that. So some construction...
Have the punishment if in the situation lockdown now, some office open and keep the work in the office? Have the punishment from the government?
We haven't. I think they have the power to do this, but they're not doing it. They're not using it, and they have given permission for some areas to stay open. So construction sites, construction is still working, and some factories are still working. So so we in the a lot of health workers are very angry about this, because we think everyone needs to stay home. There is no, unless you work in the public service, the health service, or you're working for the government, you don't need to be working. You should stay home for the next month or two. But the government is allowing some parts of the economy to keep working, and we think this is allowing the virus to spread still. So it's not a total lockdown, and I think it's leaving some small areas where the virus can still spread. So it won't be as effective as it should be, as it needs to be.
Okay, so you in there, how this virus can be more fastest spread in there? So my question is why? Is this because the people not have the healthy protocol, or?
Yeah, I mean, there's a lot of factors that affect it. I mean, like here in Northern Europe, we a lot more of our social activities is taking place inside. It's a colder climate, and we have historically we have very poor ventilation in many of our buildings. So and we know this virus spreads very, very well in when you're in an enclosed space with poor ventilation. So that is one factor. In the winter, these viruses spread much more easily because of the cold environment. And again, many more people are inside. So we know it's being spread that way. There is other factors is, if you are in our poorer communities, in the poor communities, you have many more people living together in one household. So there's many more people the virus can spread through. And then there's other factors, like the government policy has been very inefficient and has been more focused on keeping the economy going. So they closed schools. They never fully closed schools, and they reopened them from September. And although the virus does not really affect children that badly, the children are a great what we call a vector for transmission. One infected child will come into a classroom of 30 and then infect those children, and then they will all go home and they will take the virus home. And this has been a huge factor in the spread. The fact that schools are still open, and that one infected child can infect a whole classroom, and then they will all go back take the virus home. And most children don't have any symptoms, so it's very hard to detect if they have the virus until their parents catch it. So this has been a big factor in why it has spread. The government only agreed to close the schools with the national lockdown on the 5th of January. So they were open previously, and we think that was a big factor in why the virus spread so much.
So mostly for the community itself, yeah.
Yeah, it's community spread, yeah, and through the workplace as well,
Okay, so
yeah.
yeah, in anywhere in Indonesia too, and you in UK, I'm very appreciate and honorable with the health workers. You know, you nurse, and then yeah, your yeah, never been, yeah, you have the 1 week in and 1 week free, yeah, for the rest the your activity from the in the you in the hospital Saint Thomas, yeah, in emergency
Yes, yeah,
department. Yeah.
yeah.
So how do feel how the nurse and health workers with this situation?
Everyone is very tired, and our morale is very low because we have been in this situation now for 10 months, and
Yeah.
a lot of us feel this situation could have been avoided if the government had locked down earlier. Then we would not be seeing so many infections, we would not be seeing so many deaths, and we would not be overwhelmed. A lot of health workers have psychological problems because of what we've seen over the last 10 months. It's been very stressful. We have not had adequate PPE, like masks and gowns, to protect us. There have been protests over this, and we have felt that the government has not bothered to protect us. And then there is the emotional cost of, many staff have, especially working in intensive care, many staff have seen many patients die, and um, the worst aspect is because the virus is so infectious, we cannot allow families in to be with their loved one. So many people, when they die in hospital, they will die alone with no one around. And the only person who's there to look after them is the nurse or the doctor. So a lot of our staff, they have been comforting people as they've died when they have no family around. And this is very, very, very hard. And it has been 10 months of this for people. And there was a study of nurses working in intensive care, and it found many of them have anxiety, PTSD, depression, because of what they have had to go through. And we have had to, because we have to create more beds in the hospital. We're all having to take more patients, and the quality of care you can give is affected. In intensive care, you normally have one patient per nurse, but now we're having to have 3 or 4 patients per nurse. So the quality of the care is not as good, and that takes a toll, because you go into this job to look after someone well and to provide good care, and we can't do this now. And this is a big psychological strain on people. So all of this has made the situation very, very hard for health workers. And many nurses and doctors and other healthcare workers are really suffering because of this.
So
there's very, very high rates of sickness amongst
very
staff.
hard. Yes, yes, I can feel it. That, yeah, I can feel that. Yeah, it's, I don't know when it's over.
Yeah.
Is, yeah, maybe forever, or yeah, I don't know the vaccine effective. Yeah, or not, we can see, but mostly patient come to hospital. Is like what the condition
So
in your hospital, yeah, especially, yeah.
yeah, so when people arrive to us, they normally if they have symptoms, they have a fever, a cough, difficulty breathing. They are we say they are hypoxic, which means they have
Yeah,
yeah
oxygen. Yes.
yeah low levels of oxygen in the blood, because the disease is attacking their lungs, and the inflammation is stopping the oxygen transfer. So yeah, we have to give lots of oxygen, and we will give medication for the fever and steroids for the inflammation. So yeah, so most people who require admission will have those symptoms, and we'll move them to a ward, and we will administer oxygen, steroids, other medications to them. The hard thing is that we don't know who is going to get sick and who is going to recover. You know, with other diseases, you can have a good idea based on the patient's history, their age. But with COVID, we don't know. You know, some people can be quite young and healthy, and then very suddenly, in maybe 10 or 12 hours, they will deteriorate very quickly, and they have to go to intensive care, and you don't expect it, and it's very hard then, because you can't plan the care very well. Some people will get well in 2 or 3 days, and then they can leave the hospital fine. Other people, they'll be there a week on a ward, and then they will deteriorate and be moved to intensive care for 2 or 3 weeks. If they survive, they will come back to the ward, but we don't know. And we're seeing many more younger people now. The first wave, it was mostly elderly people older people who were affected, but now it's all age groups. And we think
mostly how old age you saw?
I mean, you know, the highest number is maybe people in their 40s and 50s.
40s, 50s. Oh.
Yeah, that is the highest number we're seeing now. But we are seeing people in their 20s and 30s as well. Not as many, but still more than back in April. So, yeah, the scientists are still trying to work out whether this is due to the new variant or whether it's just because the virus is much more widespread now. Because we know it's less, you have less chance of dying if you're younger, but you know, obviously if a million people in their 20s are infected, then still we will see quite a lot in hospital, even though we know it's, you know, and we think, and we probably, I think they have recorded in total, we have 3 million infected over the 10 months. Over the last 10 months.
3 million just in UK.
Yeah, in fact, yeah. And those are the ones we know about. Those are the ones with a test. At the start of the pandemic, we were not doing a lot of testing. So there were lots of infections who we missed. So the real number of infections is probably a lot higher than that.
Okay, I have the question from the Dina Effendi. She is my colleague in my university, Bungkano University. Yeah, she said, in UK, what is the citizen response to accept the vaccine? Because Indonesia people must be accept the vaccine injection. Yeah, in Indonesia now, firstly have the vaccine, and then all people in Indonesia must be injection, especially now, first period for the health workers. How about in UK?
Yeah, so the vaccine is generally supported and accepted by everyone, by a lot of people. The government, the main problem is the vaccine supply. We are trying to vaccinate as many people as possible, and all our hospitals and all our doctors are working very hard to do this. And the public wants to be vaccinated, but we don't have enough of the vaccine at the moment to vaccinate everyone. We are still waiting for it to be produced in the pharmaceutical factories. There's a minority of people who don't believe the vaccine, and they believe the conspiracy theories behind it, and that is going to be hard, but we just need to have lots of patient conversations with people to persuade them. There is a concern because some of our ethnic minority communities are very distrustful of the vaccine, and something like 70%. There was a survey done of how they felt about the vaccine, and 70% said they would not accept it. We think this is down to generally because of they have had poor experiences of our healthcare system, partly due to racism and issues like that. so they are less distrustful of these treatments. So we need to do a lot of work to reach out to ensure all communities get vaccinated. But I think the main issue at the moment is the supply of the vaccine. All of our doctors, nurses we are really prepared to give it, and we are setting up vaccination hubs in the communities, and a lot of our general practitioner, your local community doctors, they are all preparing to give the vaccine, but they don't have enough supply yet. The government is trying to vaccinate, I think, 15 million people by February 15th, this is the 15 million is the most vulnerable. So this is your 80-year-olds, 70-year-olds, 60-year-olds, plus everyone who has a underlying health condition. So they want to have the most vulnerable vaccinated by the middle of February. That is the plan, but we're not sure if we have enough of the vaccine yet to do that.
Because the vaccine itself is still waiting for.
I think, yeah, I'm not sure of the exact reason. I think there's maybe it's just trying to produce enough of it and to ensure it gets to the place. Also, the Pfizer vaccine, it has to be stored at -80 degrees.
Yeah.
And you don't have that facility in your local community. It's only in specialist pharmacies or in a hospital. So now we have the AstraZeneca vaccine is being produced, and that can be stored at room temperature. And they are trying to get that one out to the local communities and to pharmacies and places there. But yeah, I mean, this is the issue, that because the virus is so bad now, our hospitals are having to devote all our energy to fighting the virus, and we're not able to spend as much time doing the vaccination programs. And this is a big failing of the government. You know, if they had put us in lockdown a few weeks or a few months ago, we could be in a much better situation to do the vaccination. But they decided not to do that, and we are all paying the price now. So
about the vaccine, is have the policy for the government, everybody must be vaccinated, or just by itself?
It is voluntary. Yeah, so it's voluntary. You are not being forced to take the vaccine, which I think is the proper thing. It should be voluntary, because if you make it mandatory, then it's ethically is a very bad thing to do with medical procedures. You should not force treatment on people. You have to persuade them, and so it is voluntary.
Voluntary. Is it free?
Yeah, and it is free. Yeah.
Oh, okay.
So that is so it is accessible to everyone. At the moment, you call a call center and you make an appointment, and then you can go if you're in the vulnerable category. So older people and people with health conditions. So and NHS staff are being vaccinated too. Yeah.
Oh, so is this all NHS staff itself is voluntary? Yeah?
Yes.
So if you don't want, it's okay.
Yes. Yeah. You can say no. Yeah. So we need to persuade people to take the vaccine. Yeah.
Not push the people. You all must be 50. No, not like that.
No, not like this. No. I mean, yeah, and this is the way it has to be. Unfortunately, because the government because they have done a very bad job of managing the pandemic, there is a lot of distrust amongst NHS staff. Even some healthcare staff do not trust the vaccine, and they say, "Oh, I don't trust the government because they've done such a bad job," you know. So we have a lot of work to do to persuade people.
Do you feel how the effective vaccine?
From the studies I have looked at, it is effective. I think it's very important to say the vaccine does not stop you catching the virus. It will just mean that you will not get ill from it. it makes you, if you can still catch it, but you will be, you will have no symptoms. So it will. The crucial thing is we don't know if you have the vaccine and you catch the virus still, we don't know if you can still spread it. There haven't been enough studies done on that, and we don't have enough real world examples of this. But the plan is that it will stop the virus killing people.
Stop. Yeah. Okay.
Yeah.
But more. The symptom is more low.
Yeah. Yeah. Exactly.
Okay.
That is so. It will. So we're hoping that it will stop the virus spreading, but we're not sure yet. We have to see. So
okay. So how about the type of vaccine? For Pfizer, AstraZeneca, Moderna, Sinovac, yeah, and everything else. Do you have all the same vaccine, or have the more? For your view,
the UK government is using the Pfizer vaccine and the AstraZeneca one. Those are the ones that we've got.
In Indonesia, is Sinovac. Vaccine.
Oh yes,
now.
But
soon will be same. Pfizer and the Moderna also. So is it all vaccine is same? Yeah, the effective is the same, or
from what I've read, yes, generally they are generally effective. They work in slightly different ways to create immunity, but they all create some immunity to the virus, so that you will not have ill effects. So
the any type is same, same
yeah, I think I'm not I'm not an immunologist, so I can only say I think it will be. From what I have read, it will they all provide some level of immunity, which will mean that people are protected against the worst effects of the disease. Yeah. Okay. So, but I can't get into the details.
Yeah, I know. The spirit is same, for the stop the disease.
Okay. Yeah.
Oh, here's have the question now. Is from Reno Manggala. Is there any important cases so far? How's UK government protect from it?
I mean, our government has had one of the worst policies for imported cases, because they are not testing people who come to the UK. For the last 10 months, you have been able to land at a UK airport from anywhere in the world, and all they do is they say you need to quarantine for 2 weeks, and no one checks that you're quarantining. No one does any tests. So I think we have lots of imported cases, but we don't know, because we're not testing anyone. And there were some restrictions, like in February, if you came from Wuhan or you came from Italy, they would test, or order you to quarantine, and there were some restrictions. But then, since then there has been nothing, and people have been able to come and go. And even now, I think the government has not. The only time they've stopped people coming here is now this Monday. They are putting a what do you call it? They are putting a travel ban on people coming to the UK, but only today. Like Monday is the first day they have done that for the whole pandemic.
All international flight.
Yeah, they're putting a ban, and it's very hypocritical, because we have allowed people from the UK to travel everywhere, and to take the UK variant is now being found all over the world. So we did not take any precautions to protect anyone else, but now the government is saying, we'll put in a ban now to stop other new variants coming in, because apparently there is a South African variant and a Brazilian variant. Yes. They're saying, now we will close the borders because there's these other variants. But actually, we had a new variant in September, and the government did nothing. did nothing to stop that variant going anywhere else. You know, so it is hypocrisy. And again, this is, our government is more concerned about, you know, saving face, is more concerned that it doesn't look bad than that its policies are effective. You know, if they had been, you know, if they had been serious, then they would have said to people who were going, you know, they could have said to people when they found the new variant, they could have said, okay, we want everyone who travels to have a test before they go, you know, to make sure no one is traveling who is positive. But they have done nothing like this. And again, it is they are putting the economy before the health of the public and the health of the world, because if you have to start, everyone has to get tests before they travel, it will, you know, tourism will all be stopped. A lot of international business travel will be stopped. And this is the worst. You know, this is a really clear example of how they are prioritizing business. They tried to make, no, business travelers who are coming here for 5 days or less don't have to get tests, don't have to quarantine.
But so far I know there must be bring the letter, right, for swab test. Like in Indonesia, if you want to go to the flight to the other province, you must have the paper. You must test, and this test will have the paper, and the paper give to the authority, and they can accept to the flight. How about in UK?
No, they don't ask for anything. You don't have to do that.
So if I'm coming to UK without letter,
yeah,
okay.
You don't. Yeah, hold on, Maestro. Sorry.
Okay, ya. Perbincangan yang cukup menarik malam ini ya dengan Mark.
Yes.
NHS. Okay. Yes, I try to introduce a little bit about what we are talking now. Yeah. So it's have no regulation about it.
Yeah.
So I come to your London with the letter. I'm free from the COVID. Yeah, maybe now it's, but before it's no.
Yeah, you could from April until December. You could have just got on a plane and come here. So, and there would have been no, you know, I mean, thankfully the Indonesian government would make you take a test, but you wouldn't have to take one to come to the UK. There were no restrictions. So we don't know how many cases came in because they were not checking anyone.
Yeah, before,
yeah.
Okay, so okay, how about the tests? You know, in Indonesia, tests mostly by self, and then also if you have the if you have ill, you close to the COVID, so you must swab test PCR, right?
Yeah.
How about in UK? So it's around 76,000 people. A lot the positive patients. How they are now to swab? Is this voluntary or same when they have the ill, so they are test and have the location for the test. Example, maybe drive through, or maybe they come to the one place to the swab test by self. Yeah, they are pay maybe. And if they have the like that, or like what to know that.
So the tests are
PCR.
Yeah, the PCR test is done. It's done in hospitals. It's done in community testing centers, like a drive-in center, like you said. You can you make an appointment and you go, you drive in or you walk in and you can get swabbed. They will send a test to your home through you go on the government website and you put your details in and they mail the test to your house, and then you swab and then you post it back and you swab yourself then. So those are the main ways, and that you do testing. And our government has done a massive expansion of laboratories to do this testing. So at the start of the pandemic, we were maybe doing 10,000 tests a day. We are now doing maybe 200,000 a day.
200 a day.
Yeah.
It's
So
everywhere in the UK.
all across the UK. Yeah. So it's a huge number of tests.
How much for the test PCR?
How much does it cost?
Yeah, the cost.
I don't know. I don't know. But
because in here around 100 US dollar. Yeah.
Yeah. I mean, the PCR test is for we are not charged for the test. The test is free from the government, so we don't have to pay. Yeah. So.
Also, I can by myself wanna check swab test in there. Example, yeah. If I'm in the UK.
Yeah.
I'm free for the swab test.
Yes. Yeah.
So I'm not paying.
Yeah, you don't pay. Yeah.
Oh, okay.
So yeah.
So that's why the tracking is very big. Yeah.
Yeah, the number. Yes, exactly. I mean,
yes, because
the more testing you do, the more virus you'll find. But that's important for knowing whether the pandemic is getting worse or not. If the problem in March and April is they were not doing a lot of testing, and so we didn't know how bad the pandemic was. We just had to estimate, and whereas now we have a much better idea.
In here is when the first on March is around 3 weeks or 2 weeks you waiting for the PCR result. But today, so today can be 1 day. And
yeah.
So back to your work, working in the nurse in your hospital. Do you saw the patient spirit when they are positive COVID? They are hopeless or they are very sad? Or...
Most people are just anxious. They're very worried, and scared, because you don't know how badly it's going to affect you. Some people they will just have a cough and a fever for 5 or 10 days, and then they get better and it's no problem. But other people, they will, their lungs will be very badly affected and they will be put in intensive care, and it's very difficult to tell who will be affected or not. So I think the main reaction is being scared, very scared.
How you, from the health workers, give a spirit, psychological, to the patient?
We try and reassure them that we are going to give them the best care that we can, and we give them advice. And we now know more about the virus than we did 10 months ago, and we are able to do more treatments for them. So that helps, but it's still a very scary process.
The situation, if somebody have the COVID is very well. I'm sorry to you, how about when you get affected COVID, right?
Yes. So
I'm glad today you recovery, and how many days you isolate, or what do you feel?
So I caught COVID in December. I developed symptoms on the 20th, and I was sick for about 8 or 9 days with a fever and a cough, and very, very weak. And I had muscle aches and a headache, and some changes to my taste and smell. So it was very unpleasant, but I didn't get too badly affected. I luckily didn't have any shortness of breath or any symptoms like that. It was just very bad fever, very bad, very feeling weak for many days, but I was able to recover. And I've had no long after effects, thankfully. There is a lot of people, unfortunately, a significant number of people are experiencing what we call long COVID, where they have effects lasting many months, and these can be be very, very tired, very fatigued. They can have, ongoing muscle aches. Some people have palpitations. They have neurological symptoms. This is again why it's so deadly, and we don't know who it can affect. I have my sister is a physiotherapist, and she has a patient now. He was a man in his 30s. He used to run marathons, and he got COVID, and now he can barely walk around his house because he's so tired, and he has these body pains and things. And he was a very fit, young, athletic person, and he got COVID, and now he is disabled almost, and we don't know how long he's going to take to recover. So you can't know how badly the virus is going to affect you, and one problem is we think some young people think they think, oh, this virus only affects people. And then but actually it can affect everyone.
Anything, and
exactly.
So do you have the tips, or do you have what medicine you consume during your
if you're at home, if your COVID is not too serious and you can manage it at home, the main treatment is just drink lots of water. If you have a temperature, you can take paracetamol. If you have the muscle aches or pains, then ibuprofen is normally quite good for that. And you just need to rest and try and eat nutritious food when you can. Those are the main tips I can give for managing it at home. And most people will recover in 5 to 10 days if they have those kind of symptoms. If you're, let me show you.
Yeah. Okay.
What I'd say is useful is if you can get a pulse oximeter.
Yeah.
Like this.
I have it. Yeah.
And you can monitor your oxygen saturations on this. And this is the main an indicator that we use for monitoring patients in hospital, and it's one of the a key sign that your COVID will get worse is that your oxygen saturations.
How many? How if it's possible is COVID? 19?
Yeah. So for your average healthy person, it should be about 96 to 99, 100%. With COVID, if it starts to drop to 94, 92, then you need to go to hospital and be checked and potentially be admitted then, because then you may need extra oxygen to compensate for what you're not able to take in through your lungs.
So this is for detected for the first time, before.
Yeah.
So
the oxygen saturation is deteriorating is an indication that the COVID your COVID infection is getting worse, and that you probably need an admission to hospital, or at least you need to be assessed in hospital. So these are, I say these are inexpensive in the UK. I don't know how. They're maybe more expensive in Indonesia, but they are a good. Then I think these
much better.
cost about £20.
Like vitamin or medicine.
I think there is. I think there's some evidence that people can take vitamin D, and that people with vitamin D deficiencies are affected worse by the virus. So if you take vitamin D. But I don't want to recommend any more than that, because that isn't my background and speciality. I think if you're eating nutritious food and a good diet, then that will be normally good enough for most people, I think. So
okay, during your today take care with the patient COVID, what the unforgettable moment during this time?
Yeah, I think I mean it's difficult to say. I think some of the there was a shift where we had to intubate quite a lot of people in our resus. I think it was the height of the pandemic back in March or April, and we had many, sometimes. So, for those who might not know the language, intubation is where you put the tube into someone's throat so you can put them on a ventilator or breathing machine. And, in our resuscitation department, in the emergency department, I think we had to intubate 5 or 6 people on one shift. And we don't normally have to, sometimes you can do a whole shift you don't have to intubate anyone. No one is that sick. But this was a very heavy shift. And to see that many patients, so much. And particularly, I remember is probably the most, one particularly sad. He was an elderly gentleman who was in his 80s, and he he was so unwell that within half an hour, 1 hour of coming into the hospital, we had to intubate him, and we had to have that conversation that, and you're having a conversation saying, we're going to put a tube down your throat and put you to sleep, and we're not sure if you will survive, and we're not sure if you'll wake up, and also you cannot see your family, and that's an incredibly hard situation to be in. And that is, I think that moment stuck with me. But then that same conversation has had to be had with hundreds, that's had to be had with thousands of people, and some of our doctors are having that conversation several times a day with patients. And this is the emotional, psychological burden that many people of the healthcare workers have to bear, and it's very, very, very challenging. I remember that conversation because it was one I was involved in, but staff are doing this every day, multiple times a day, and it's a huge burden, and it's out of our control. We at a time normally in without the virus, you would try and have the family there. If you're going to have this conversation, you'd have some support, but because of the virus, we can't, and it makes it much more difficult, because you're potentially the last person that this patient is going to speak to. If they don't recover, if they don't wake up, that is the last conversation they're going to have, and that's something very hard to bear for staff. So
So very unforgettable and very touch in your heart, in the feel about you look show the patient, everything else you say. So what do you think about the still some people or many people don't believe with the COVID, conspiracy theory and everything else, and they feel, I'm not feel sick, so I'm fine. How but why I must test and everything else?
I mean, those people are it's incredibly frustrating that those people are being that they're given. I mean, the most frustrating thing is that they are being given a platform in parts of the media to talk about this, and to talk from a position of ignorance. And also that they are not accepting that they were wrong. I mean, you cannot look at what is happening in the UK now or around the world and say that, this is just the flu, as
Yeah.
some people have said, they've said, oh, we think everyone's got it already, so there's herd immunity already, and
Yeah.
we don't need this.
Right.
And I mean, we can see if there was herd immunity, well, why are we having so many more infections? Why is the pandemic worse now than it was 9 months ago?
Yes.
And these are all factors that make it incredibly frustrating dealing with them. But yeah, they are also being enabled by sections of the media and sections of business who they don't like the restrictions. They want to go back to business as usual. But the fact is we can't do that until the virus is brought under control. And the reason we're in such a bad situation now is because actually the government has not been controlling it well, and they've been, not been fully, but they've been doing, they've had a lot less controls on people than that. I know some of these COVID deniers and COVID hoaxers, they want no restrictions, but the government hasn't put in enough restrictions. I mean, partly also they haven't given enough support to people. So a lot of people are having an economic crisis. They lost their jobs, their business. And this traumatic period is obviously making people angry, and they're looking for answers, but they are getting answers in the wrong place from these people, because, you can say, oh, COVID is a hoax as much as you want, but it's not going to go away until we treat it. But this misinformation is just a distraction. It's leading to, and it was making things worse for the population, because it gives people a false hope or a false belief. And it also makes it harder to bring the virus under control, because it means people don't follow the rules, people don't wear masks, people don't want the vaccine. And all of these things will make it harder to control the virus. So.
Oh, okay. So, how about health protocol? Mask, washing your hand, social distancing.
Yeah.
This is effective?
Yes, completely. I mean, this is the main tool we have for controlling the virus, is social distancing, mask wearing, washing your hands. If everyone follows that, there'll be less community transmission, there'll be less infections, less spread of the virus, and it will it will help cut down. So these are vital things for everyone to follow. Yeah.
So you, from the health workers, have the view how disease will be stopped, or if the forever, have you have the opinion, if the COVID is still forever, maybe you have opinion what should do, or what the what should do.
I mean, so I believe we can control the virus to a point where we can go back to normal life, but we need to pursue what's being called a zero COVID strategy. So we need to lock down until we get the number of infections very low, 50 or 100 per day maximum, and then the community test and trace system, track and trace, can be effective. And I think and then we'll be, once we have got the level of virus very low and we're tracking all the infections, then the government will be able to lift the restrictions and we'll be able to go back to life as normal. And then hopefully the vaccination program will also mean that less people are affected. But I do think we will have to have some of the restrictions for a long time, potentially. The mask wearing, some of the social distancing, the hand washing, this will all have to remain. And we may have to be used to COVID becoming a regular thing. I don't think it will go away for good. I don't think that's possible. And I think because of that, some restrictions will remain for a time. So I think life can go back to some semblance of normality, but there will be some effect from the COVID for going forward into the future. But I think, you can look at places like Taiwan, New Zealand, Australia. They have very effectively controlled the virus to the point where they're allowed to open up their economies and go back to normal life for most people, And I think that's something all countries could aim for, but they need to adopt the right policies, and they need to work together and they need to prioritize public health, not the economy.
Oh,
You save the economy by saving public health. Once
not the
public
balance,
health,
economy and health balance.
yeah,
No?
yeah. Our government tried to balance the economy and
Yeah.
health, and they've ended up destroying both. So
Oh, okay.
yeah, public health must take priority.
So the
But you
future.
can.
Yeah, you can.
Sorry, go on. No. That's
Yeah, you go.
yeah. No, that's it.
Oh yeah, yeah. Okay, so public health must be in the future maybe must be priority.
Yes, yeah.
Like
I'm going.
public health, climate change, climate crisis, and everything. Then economy.
Yeah, it will. Yes, yeah. I think it will go. If we deal with all these crises, then the economy will do better. If we don't, if we say, oh, we want to prioritize the economy, then actually we are going to be damaging the economy, because if you have climate crisis, your economy will suffer. If you have public health crisis, your economy will suffer. You know, these are, by prioritizing the economy, you do much worse for everyone, and much worse for the public, much worse for the environment. So yeah.
Okay, the last, Mark, you, once again, I'm very appreciate, honorable you, and all to health workers in the world, also in Indonesia, same too, with the, this every situation, distance with family and everything else, still do it for the patient. And what your message, Mark, as you nurse, health workers, maybe this message, will be have the YouTube, and then maybe everybody will be watching too. Your message, as for the nurse with this pandemic, about the pandemic COVID-19 now and the future.
So, yeah, sorry, Maestro. What is my message to other nurses and health workers, or to the public? Sorry.
The health workers, public, and everything else. You feel like what we learned, what you learned, or what we learned from this pandemic.
Yeah, I mean, we've learned a lot about the inequalities in society, and I think we've learned the cost of not prioritizing public health and healthcare. We've seen how badly, these like a simple virus can affect the whole world, and I hope this leads to all governments taking this much more seriously and investing more heavily in public healthcare and in their health systems. And I say to any healthcare workers, who watch this, that we're going to have to campaign and fight ourselves to make sure that governments invest in our services, so that we're better prepared next time, and we don't have to go through the same effects again, because it has been terrible. But we don't ever want to be put in this situation again, and I think it's up to us to kind of campaign and fight for the investment we need, and the protection we need, and the support for the public, so that they are not as badly affected. Because the health inequalities that have made COVID much worse for many communities, they need to be tackled as well. Yeah.
So for the communities, for the ordinary people, communities, what you your message, or your
and for
still help.
For the public, it's just, COVID is real. Please take it seriously. Please follow the social distancing, mask wearing, and hand washing. Follow the government guidance, and stay home and stay safe. And hopefully we can all get through this together.
Yeah, I hope so too, Mark.
Yeah.
We can help together, and then hopefully this pandemic is more fastest going on from the world.
Yes, the faster it's over, the better. Yeah.
Yes, we're back to normal. New normal.
The new normal, yes.
Okay, Mark Boothroyd from the North NHS in St. Thomas Hospital. Thank you for very, very much. I'm very appreciate, honorable. Thank you for your time tonight. Nice to talk with you, and nice, very important message, your experience and everything else. Thank you very much, Mark.
Yeah, thank you, Maestro. It's really good to talk to you, and I hope this this has been very useful for anyone who watches. So thank you for giving me this opportunity. And yeah, you take care and you stay safe as well.
Same, Mark. Stay safe to you. Stay healthy, and yeah, keep with the health protocol. And also, I hope you and your family, your sister, all is your girlfriend also is healthy, still healthy and safe.
Yeah.
And we can talk again soon together.
Yeah, definitely. And same to you, Maestro.
Yes, thank you very much, Mark.
Yeah.
In the evening, yeah, in UK.
It's the afternoon now. So.
Oh, yeah, afternoon in UK.
Yeah.
Sorry, in the night in the Jakarta. Yeah, thanks, Mark and Pak
Yeah.
Astra. Thanks, Dina. Also, Reno Manggala for your question tonight. It's very good and very nice.
Yeah.
Once again, thank you very much, Mark.
Yeah. Thank you, Maestro.
Stay safe, stay healthy, and
take care.
take care.
Goodbye.
Bye.